Good evening or good morning, everyone. Whoever is watching this program, maybe my best wishes from Dr. Gurunadh. Myself, I'm an orthopedic surgeon, robotic joint replacement surgeon, and a pediatric orthopedic surgeon working currently at Srikara Hospitals, Vijayawada. First of all, I would like to congratulate all the people on the earth who really struggled hard and survived this pandemic. So, this pandemic made us to learn many new things. Maybe, see things that are very much neglected or underrated for the past 30, 40 years of our life. So maybe this is the era where the people should look back into their lifestyles. Maybe I cannot say it as a mistake, maybe a faulty lifestyle, or it can be maybe because of their competitive environment and maybe because of different other factors which cannot be controlled by ourselves without motivation, maybe because of the situations around us prevailing. So now I take this privilege with this program to make an emphasis and give some more importance. What exactly is this musculoskeletal disorders or musculoskeletal weakness? We just happen to see a lot these times. See, many times we know that patients who are working at home right now, most of the corporates and software people who are working at home are bound to sit at one place, may or may not be in a proper sitting postures, may or may not be having an ergonomic chairs or ergonomic type of tables with keyboards, mouse, and everything. But they still continue doing their work. That's really good that you are maintaining your spirit for continuing your work. But I would like to say, but because of this offline we have been seeing for the post-COVID time, for the past 1 year, as an orthopedic surgeon in my clinic, in my OPD office, I see many patients who are coming on weekends, particularly on Saturdays and Sundays, with severe neck pains, with wrist pains, and backaches. And few cases where I've even seen that, even saw that the patients are having chronic knee pain with the radiation, like paresthesia, tingling and numbness, and the neurological involvement in their legs, who are absolutely good before starting all this work from home phenomena. Don't take me wrong that I'm pointing negative aspects of work from home, but you definitely have very good advantage of work from home, sitting at one place, working and controlling things remotely and getting into action remotely. Because you can avoid traffic, pollutions, you can be at your comfort, and you can be at your comfortable clothes, maybe below the screen level, I mean to say. So that's the benefits of the work from home, and you can still continue your work. So you might have seen many people who lost their livelihoods, who lost their jobs, their breadwinning capacity for the past 1.5 years because of this pandemic. You should be fortunate enough that you've been working still while continuing your work at remote places, at your own comfortable places, and earning your salaries without any change. May or may not be having appraisals or increments. Don't worry about it. You are at least getting your salaries or earnings, I mean to say. So right now, today I've been asked to give more emphasis about this musculoskeletal disorders, which we regularly call it as MSK. Most of you know, life is movement and movement is life. Do you know who said this? One of the greatest author, maybe from the Washington DC, I believe, Tim Brown. He made the statement, life is movement and movement is life. You know how much depth does this sentence of the statement have? Can you imagine yourself sitting at one place without moving any single part of your body, not even your eyes? No, right? So whenever there is a movement, there is life. Whenever there is a life, there should be a movement. So this is how we indicate the differentiate the living beings from the non-living beings. I mean to say, starting from amoeba and algae also. So as the name indicates, muscles and bone are involved mainly in this musculoskeletal complex, which is involved in the movements of the body. So musculoskeletal system plays a vital role in mobility and maintaining the good health. I mean good health. Okay, underline this word, good health. It means a lot. It's not just the non-diseaseness or not getting fever or something like that. Diseaseness. So anything that causes disturbance in the easiness is a disease. So if you are having a good health, that means to say you are at your most ease position. Make sure that you retain that easiness in your body. Emphasis over the active participation of the life with the different life changes, life challenges that we have, maybe socioeconomically, maybe financially, maybe your work-related stresses, and it also affects the functional outcomes that what we have finally. Okay, so most of us know the significance of the fitness workouts in our good health. Okay, to maintain our good health. Many times people ask me what is basically the difference between good health and physical activity or physical fitness. So good health means maintaining a balanced physical, social, psychological, and financial stability is good health. Good physical fitness or a physical fitness is just to maintain a good body. You may be psychologically fit or may not be balanced, that's a different story. So along with being psychologically, along with being physically fit, you have to be psychologically fit also to face the challenges in your life, to face the occupational challenges. Maybe often many of the people might be facing a socio-domestic problems at your homes. So you should be ready to take care of all the stresses, and you should be ready, fit enough to take care of all these kinds of pressures that you may have to undergo even without your option or choice. So any sort of insult or infection or injury to this musculoskeletal complex obviously limits our activity. You might be knowing about it. It limits our activity level or the presence of our physical appearance in the physical activity. So obviously it gives a great impact on our functional outcome. So any impact on our musculoskeletal injury, musculoskeletal system leads to pain, which could be a acute pain, which is present for the past few hours or maybe 1 or 2 days, or it can go up to chronic pain, maybe some months together, like low backache, wrist pains, neck pains, all these things will go for months together. That is called a chronic pain. So once you are subjected or versatile for these pain-related conditions, you might understand that you are reducing your happy-free life. You are reducing your pain-free years of your life. You are reducing your work capability, ability, or work capability hours in your life. You may have to take lots and lots of ons and offs from your work, maybe your life, maybe your personal life, physical life, occupational life, anything that affects finally into your psychological stability. So obviously, you should understand the definition of musculoskeletal good health. So once you get into this, then you will know the importance of the significance. Many of you might be knowing about it. Doing exercise in the morning gives a good health. In taking green tea gives good health. Taking healthy food, avoiding junk food gives good health. How many of you are really following it? How many of you are really following every aspect of the good health? Ask yourself. You might be knowing about it rather than anyone else. Nobody needs to point at us and tell it that you're not doing this, you're not doing that, you do this, you do that. We know it by ourselves. We are adults. We should be aware of doing it, what is good for our health. And thanks to the media and the internet, probably you might be having a vast information and availability at your button click, which gives you a good insight, options, different methods, maneuvers to maintain this good health, both physically and also psychologically. So finally, as I was telling you, it may show the impact on financial, social, behavioral, functional outcomes, and final symptoms may become chronic or acute pain with limitation of mobility, decreases the quality of life, which is not at all good for us. And this series of inefficiency results to psychosocial abnormal behavior also. So if you realize that you're not doing good at your work, even at your home, you'll definitely get that thought process running in your subconscious brain, which may affect your behavioral aspect also. So one single word, musculoskeletal system or MSK, definitely makes a very big impact in our body. Many of you might be thinking that why should I need a six pack? Why should I need a biceps? Why should I need a big triceps? Why should I need all these things? Yeah, definitely. You don't need all these biceps or six packs or triceps, big triceps or big pectorals or chest or big chest. You just need exercise or fitness to maintain your good health. That's all what I mean to say. If you are motivated enough, if you are good enough, If you're good enough to spare time to build up some more muscle, that's always a very good thing. You can definitely go ahead and do that. Not an issue, but make sure that you at least maintain this basic level of good health, both physically and also psychologically, before going for any exaggerations of your physical fitness. Don't worry, I just made few points noted down because I get a lot of questions, so that's why I'll be looking at the points which I noted down. Don't worry about it. So significance of impaired musculoskeletal health, you might be already realized about it. Global awareness about the musculoskeletal health and its maintenance is on rise now. See, do you imagine or do you believe that there are many societies or many associations have been formed, especially to discuss and to debate on these musculoskeletal issues? Yeah, that's really true. You might be surprised to know that, but that's really true. Many times you might be not giving any importance or significance any of these small news that you can come across your media, that a musculoskeletal society of the World Congress have met so and so in Geneva or Venice or anywhere somewhere else in the world to discuss different aspects of the health related issues. But definitely, if you pay some attention to them, you'll get to real scenario what exactly is happening. See, basically, world developing countries and developed countries are actually pushing very hard their research laboratories, pushing their limits or the boundaries to make sure that the retirement age is increased. That means to say they wanted people to work for even beyond 60 years of age. Means to say that they want a healthy individual who is capable of performing or delivering his capabilities or work efficiency even after 60 years. That will obviously increase their productivity. It could be business productivity or software productivity or any kind of productivity that makes a market. So developed countries and many of the developing countries are making a very good research and commandments or amendments in the regular diet pattern, fortifying of the foods, regular exercises. You might have seen even our PM Narendra Modi ji also made many emphasizes or many speeches about the Surya Namaskara. Why would a person like him at that higher position would give lecture about a simple physical exercise thing? Because people, governments, and the World Congress are exactly looking into this issue also. It is their basic duty or responsibility to maintain the physical fitness of the persons or the people of their country also. So finally, what I mean to say is like global physical fitness or the musculoskeletal congress have been looking very keenly to every aspect that is affecting the musculoskeletal health. You might have heard a word called ergonomics. Many of you might have already gone through different scenarios or different sessions about this ergonomics, where the people will be talking about the posture related issues. Do you know what exactly is ergonomics is? Ergonomics is making yourself fit for the job and making job fitting for you. So if you are into certain kind of work, you should make sure that you can avoid all occupational hazards. So like work from home, where you take like you might be happen to sit for hours together at one place, and you happen to do some work hours together without any stretchings or something like that. So that may affect you in a long term. So there are certain positions or postures of your body which to every joint, every single joint of your body to make sure that they are not getting under stressed even after working for long hours. So make sure that you follow this ergonomics into in every aspect or in every work in your lifestyle. See, it is not meant only for the occupational work. There is ergonomics even for cooking also. Do you believe that? Yeah. Ergonomics for washing clothes, ergonomics for cleaning utensils, ergonomics to prepare a bed, ergonomics to do your desktop or laptop job, ergonomics to do a surgery for me. I even follow that. I definitely follow all those ergonomic topics. Okay. So when I was asked about what is the impact of impaired musculoskeletal health by many people, I told them that it's a global burden. When a close community gets impacted with the bad musculoskeletal health or bad physical health or a poor physical health, definitely their working capacity will be reduced. Definitely their harmonious life or the understanding life is getting compromised with other co-persons of their life. Definitely there is a big deficit in the per capita income and in turn to the government also, to the country also. So I always tell them, see, it is not just eating good food is important for the body. It is also to maintain a good physical health along with psychological balance. So one of the most common work-related problems that I regularly see is the low back ache and the neck pains. Low back ache and neck pain account for more than 70% of the occupational hazards. That's very bad to hear that. Yeah, true. Correct. But you should be aware of why these low back aches usually come to us because of the abnormal postures. Check yourself when you're working today. You might be sitting in a posture which is totally awkward, and you know that. You definitely know that this is awkward. You may think that it is for your comfort or it has to be done in that way, or you may not be pointing much of your attention towards that event of your work pattern. But that's the point where you're damaging your health. That's the first step you're taking towards the damage of your health. Make sure that you cut off that first step. Okay, so that will help you in putting your good health together. So do some physical exercises, dial, make it as a routine, like a calendar, like eating food 3 times a day. Do some stretching exercises every now and then. Usually there is a protocol for that. Every half an hour or maybe 1 hour, you should get out of your chair, do some stretching exercises for your neck, for your shoulder, for your wrist, for your elbows, for your chest, even doing some breathing exercises, for your spine turn this way, that way, forward, backwards, for your neck, doing it in a round circular fashion, and for your legs, doing some ankle pump exercises, knee joint movements, hip joint movements, do some squatting exercises. That will definitely help in redistribution of the blood in your blood circulation in your body. That will help, in turn, helps in washing away of all the poisonous materials or the toxins that gets accumulated at one certain place because of long hours of sedentary lifestyle. You got that point, right? Do you know that how much of bad materials or the unwanted toxic materials get accumulated at one certain place for 20 minutes of sedentary lifestyle? No, I'm not going to say that. You please check it by yourself. You'll get surprised for that. Okay? Right. Then you will get a real motivation to do a good physical fitness program. Maybe a bigger one, maybe a smaller one, maybe a brief period, maybe for a longer time. That doesn't matter. It only matters whether you start it or not, whether you're maintaining it continuously or not. Persistence is very important. Persistence of motivation is also very important. Make sure that you definitely spare some good amount of your time in maintaining this physical fitness to maintain a good musculoskeletal health and maintain a good health. As I mentioned, good health. Okay. Since musculoskeletal conditions are chronic and painful, associated with disability and social derangement, it in turn causes a depression-like feeling in your psychological, psychosocial elements. So that also affects your lifestyle. So make sure that you pay a certain attention to all these small issues also. Many of the times, these musculoskeletal conditions are categorized as non-communicable diseases because they are not communicated or communicable from person to person. But what I say, you can make it communicable when you start getting motivated to be a good physical exercise. Maintaining a good health is a communicable disease. If you do exercise, you'll motivate your friend, you'll motivate your colleague, they'll get motivated by you. So you do it and become an example to your colleagues. You do it, motivate them to do the things. So make it communicable. Make it communicable in your own terms. Make it communicable to maintain and to get a better, healthy society. Maybe a musculoskeletal disorder is a non-communicable disease, but you make it communicable by making it fit. Okay, I hope you might have understand about it. Low and middle socioeconomic countries are also actually, in fact, many of the low socioeconomic countries are also facing a lot of problem in getting good amount of functional outcome from their fellow workers, mainly because of the bad hygiene, no exercises, no proper food, different factors. And they are also paying a good attention in how to increase or how to maintain this musculoskeletal health. So, as I keep telling about all those things, you might have understood the role of physical inactivity and sedentary lifestyles. Definitely, they have a very big effect on the sedentary lifestyle and physical inactivity. I can say, see, if you are happen to do a sedentary lifestyle today, that becomes a hobby for a few days and habit for your lifetime. So, better not to get into those hobbies and habits. I get surprised to know that many people are having watching TV or movies as their hobby. Because I don't understand. Why do you want to sit at one place? You watch a movie, definitely. That's a good. That's very good. Watch television, watch a movie. That's only for your entertainment. That's only to get relaxed from your sedentary lifestyle. You have to stretch your body even at that moment also. Make sure that you are not at your most peak sedentary lifestyle eating burgers or a cheesy food while watching a movie or a television. Make movement as your hobby, not looking at something. Okay, not a sedentary lifestyle. Make movement as your hobby. That really helps you a lot. And you can in turn motivate or become an example to many of your friends. Increasing physical activity and optimizing exercises, which are recommended by many of the arthritis societies of the world, definitely helps in maintaining a good musculoskeletal health. We being orthopedic surgeons attend to many kind of this arthritis and the musculoskeletal society meetings and all. Many times we talk about these things. How to reduce the burden, how to mobilize things, how to motivate people, how to mobilize the muscles without causing the problem to them. Every person will have their different ability levels. You should understand what is your ability level. Then only you can get the things right. Good. Yeah, and then there are many recommendations by WHO, like nearly 2 hours per week of moderate physical exercises, or at least 20 minutes per day of any kind of physical activity like brisk walking, we can help in reducing your sedentary lifestyle. Do you know the main complication or enemy with sedentary lifestyle or an end result of the sedentary lifestyle? I mean to say, yeah, you are right. Obesity. You all know how difficult it is to burn a calorie. Many of you might have already undergone a gym settings or physical fitness settings. You might have seen eating one pizza builds up around like 400 to 500 kilocalories in your body. Yeah, hardly takes less than a minute to eat one good slice of pizza. But do you know how much time does it take to burn 100 kilocalories? Yeah, 10 to 15 minutes of cycling, 15 to 20 minutes of treadmill, walking for more than half an hour, running or cycling for more than half an hour at your regular 5 kmph speed. True, building up calories is very easy, but burning them is really hard, really hard. You really need to work very hard for that. It should be limited at your initial stages of obesity itself. Otherwise, you're gonna get trapped into it. Obesity leads to physical inactivity. Physical activity in turn leads to obesity. Obesity leads to physical inactivity, and you will remain in that cycle. Break the cycle by inactivating your physical activity. Okay, so start working from now. Evidence suggests that increasing the levels of physical activity will not only increase the musculoskeletal health but also decreases the risk of suffering from obesity diseases such as diabetes, hormonal issues, and cardiovascular issues. You might have heard many cardiothoracic surgeons or cardiologists or even physicians say that you should do a lot of exercise, walking, and all to increase the aeration of into your lungs, increase the cardiac health. That it's not only the cardiac or the lung health; it increases your brain. The oxygen capacity, the oxygen carrying capacity is increased into your brain. Your brain gets more oxygen. Your brain develops a lot. You start thinking fresh. You start thinking new. You start thinking a creative thing. Always you can create wonders if you do a lot of exercise. You can really realize that when you start doing it. Definitely. So apart from running musculoskeletal health benefits, improvements in cardiorespiratory fitness can be achieved by changing your sedentary lifestyle behavior into a low intensity physical activity, like at least start with walking. Many times we orthopedic surgeons and comprehend with cardiologists regarding this exercise part. Many of the people might be having osteoarthritis or knee joint pains or shoulder pains or elbow pains, particularly increases in this winter season. Yeah, it's not necessarily that you should do only walking. It's not necessarily that treadmill or running, jogging is the only mode of physical activity. Physical activity. There are many other modes which does not really cause weight bearing problem on your knee joints and hip joints, like swimming, cycling, yoga, pranayama, breathing exercises, and even slow slow walking. So you should also customize the exercises as per your physical needs, as per your physical conditions. If you are a patient who is already suffering with different joint pains, maybe rheumatoid arthritis or maybe osteoarthritis or degeneration or sedentary lifestyle joint pains, you should start first doing exercises which does not involve a lot of stress on your body. Your body weight should not be a problem on your joints again. You should think about it. You should customize. Don't imitate others. Exercise should always be customized to yourself. Exercise should always be customized to your own requirements and your problems. You should address your problems, not increase your problems. Focus on evidence-based interventions for the musculoskeletal conditions has been increased, particularly in low back aches and neck pains. There's a lot of research going on. You might have surprised to know that group exercise program or weight loss support can be considered to motivate each other to maintain that persistency or the consistency to attend the sessions regularly, to reduce the incidence of falls, balances, strength training, home hazard assessment, participation in fall prevention programs, and getting involved in activities like gardening, dancing, etc. also helps. You need not regularly or depend upon gyms or fitness centers to maintain your physical activity. It is your basic right. So you can even start doing dancing. You can start singing by yourself when you're alone, probably if you feel shy. So you start singing or dancing by yourself. You nobody need to judge whether you're dancing good or not. All you need to do is just move your body. That really moves every muscle. That helps in mobility. That helps in getting a good movement also. Maybe down the lane you will become a good dancer also. Don't know. Why not? Just give it a try. That's really good and awesome also. Osteoarthritis has been shown to be benefited from activities and exercises like walking, swimming, maybe aerobic exercises, which has been Zumba dance, which is being in propaganda now, maybe in Zoom, in Boom or in Zoom as of now. Aging is inescapable. Can you imagine that you cannot escape this aging process or the weakness of the bones of muscles? You cannot escape aging of your, you cannot prevent or stop aging of your muscles or bones. But you should make sure that your aging happens with healthy bones and muscles. If you do exercise right from now, when you are in 30s, maybe by 50s, you will have a good health, healthy bones and muscles. Maybe your aging may get delayed. The rate of degeneration, rate of aging of the bones and muscles may get delayed. That will help you maintain good health for long years. That will help you in rendering your services to society or your country or your company will be increased. You can maintain the persistency or consistency in your relentless services and good productivity. That will always help in upliftment of a country. A recent systematic review concluded physical exercise renders a positive impact on muscle mass and function in healthy subjects aged about 60, and by improving muscle performance by increasing the ratio of 1 is to type 1 to type 2, it increases good muscle health or good musculoskeletal health. A European Society of Clinical and Economic Aspects of Osteoporosis and Osteoarthritis also confirmed the same thing. I'm just mentioning you all these things because I just want you to know that there is a lot of research work going on all over the world regarding this musculoskeletal health. It is not a simple topic. It is not a simple job. You know how difficult is it to get out of the bed and do some exercise in the morning, maybe in the evening, preferably in the morning, maybe. Furthermore, exercise and mechanical loading also have a positive impact at the molecular, cellular, and tissue levels. Like with aging, the potential for the cell proliferation and number of stems or the progenitor like cells decrease in 10 notch. But with exercises, with maintaining a good physical health, might be your progenitor cells or stem cells which are present already in your tendons, muscles, ligaments, bones, these healing increasing cells will not get aging. They remain so. Even if the aging causes degeneration or destruction on one side, your healing cells will do the healing at the same right. That balance can be maintained. Once the balance of destruction to the healing is maintained well, your health is maintained even at the age of 60s also. That will really help you in having a pain-free years. You really might wonder, why should I maintain my health? I don't want to work after 60 or for the benefit of others. I don't want to sit and do a job for others after 60. Yeah, good. I really accept it. But you're not doing exercise to give productivity to someone else after 60. It is for your betterment. Maybe after 60, you may have to depend upon a walker or a walking aid. By doing exercise at your early 20s or 30s, you can avoid that. Maybe you can lead your independent, individualized life even at your 80s. That's what I want. You should reduce your sedentary lifestyle, and that may in turn reduces your dependency rate at your elderly ages. Yeah, that's really true. Surge in sedentary behavior and unhealthy diets have caused a global obesity epidemic, or I can say pandemic. Actually, you might have understood the word meaning of the word called pandemic. So it is becoming a pandemic now. Obesity is becoming a pandemic. You should become a change. You start doing exercise for your good cardiovascular, for your good respiratory, for your good psychosocial elevation, for your physical musculoskeletal health. Maybe you may become an example for someone else to do some very good exercise. Don't think that it will be easy for me to sit here, talk in front of a camera, giving a good lecture, nice lecture, looking at some good points into a paper. No, I'm practicing it. I'm doing it regularly. I'm telling you only after I'm practicing it. I'm an eligible person to tell you what exactly be done to maintain your good musculoskeletal health. Obesity is an important comorbidity of many musculoskeletal conditions and is closely related to the development of osteoarthritis, development of cardiorespiratory conditions, development of type 2 diabetes. All three of them are very tough to deal. You know, I'm an orthopedic surgeon. I don't need replacement surgeries for many patients as young as 40, 42 years. Why do they need to do? They need to get this knee replacement as young as 40, 42 years? Just because of their sedentary lifestyle, just because of their over obesity, just because of their unhealthy lifestyle practices. Imagine, imagine yourself in that situation getting operated at 40s for your knee pains. No, I'm not interested to do that unless you are interested to get it done. Really? True. Not only me, no other doctor in the world is interested to operate on a person unless it is required for them. If you really maintain a good musculoskeletal health, all these conditions are preventable or postponable to good amount of life. So you can maintain a good pain-free life years by maintaining a good musculoskeletal health. Lack of physical exercise in childhood causes childhood obesity. Lack of physical exercise at your 20s to 30s, middle age, leads to early obesity and the hormonal related changes. Thus, reducing obesity in any age, including childhood to adolescent, by encouraging physical activity will also reduce the risk of developing musculoskeletal pain later. Once a child has obesity, all his development factors are getting affected. I don't want to see many patients with sedentary lifestyle or obesity related complications. I want to see a society with good health. Let's join this motivational program to motivate or to instigate each other to make a better health society, to make a healthier society. I'm Dr. Gurunadh Sarma, orthopedic surgeon, Sikra Hospital, Vijayawada. Hereby request you all to pay a good attention towards your diet, towards your psychological health, socioeconomic and financial health. Everything makes a lot of impact in your life. So pay attention to even every minor details. Go through economics, go through your life, go through your positions. Again, take care. Swear for a good health. Thank you.